Medicine in the Middle Ages. Medicine in the Middle Ages was often brutal due to limited medical knowledge, religious influences, and rudimentary surgical techniques. Treatments were frequently painful, ineffective, and sometimes even fatal. Here are some of the most brutal aspects of medieval medicine. 1. Bloodletting. One of the most common medical treatments, bloodletting, was based on the theory of the four humours: blood, phlegm, black bile, and yellow bile. Physicians or barbers would cut veins or use leeches to drain excess blood, often weakening patients rather than curing them. 2. Trepanation. Doctors drilled holes into patients' skulls to treat migraines, epilepsy, or mental illness. The belief was that this released evil spirits without anesthesia or sterilization. It was an excruciating and highly dangerous procedure. 3. Amputation without anesthesia. For severe infections or battlefield injuries, amputation was the only option. Surgeons would saw off limbs using crude tools, often with no pain relief other than alcohol. Cauterization, burning the wound shut, was used to stop bleeding. 4. The plague treatments. During the Black Death, some doctors recommended bizarre and painful remedies, including covering patients with mercury and baking them in ovens. Other methods included lancing buboes, painful boils with knives, which could easily lead to deadly infections. 5. Hot iron and cauterization. To stop wounds from bleeding or to treat infections, doctors would press red-hot irons against the flesh. This was agonizing and often led to more infections. 6. Urine therapy. Some medieval doctors believed urine had healing properties. It was used to clean wounds, diagnose diseases, and even consumed as a remedy. 7. Use of live animals. Doctors sometimes applied live animals to wounds. For example, a wounded soldier might have his injury covered with a dead pigeon, thought to absorb the disease. 8. Public surgeries. Many surgical procedures were performed in front of audiences, sometimes in open marketplaces, with the patient screaming in agony as a form of public spectacle. Despite the brutality, medieval medicine laid the foundation for future medical advancements.